Well, it's 2024 and the Breakfast Rush is proud to introduce someone who can help our listeners to keep healthy. Get well if you're sick and ensure good quality of life with early detection and treatments, as well as to treat you successfully when all else fails. For those who have not had the pleasure to listen to our special guest, he is Dr. Rakesh Mohanlall, who is a leader in healthcare nationally and internationally. He holds the world's first Doctor of Clinical Technology degree, specializing in cardiovascular perfusion and non-invasive integrated medicine. Today, he also leads the way in non-invasive healthcare technologies such as biofeedback testing, cardiac three-dimensional vasculography scanning, and external counterpulsation. He's the founder and patron chief of the International External Counterpulsation Association. He is the managing director of Scaling SA, an external moderator for DUT students in clinical technology with more than 25 years of experience in the cardiac field. He has worked in cardiac surgery as a cardiovascular perfusionist, operating the heart-lung machine during bypass surgery locally and abroad. He's been trained in South Africa, in Saudi Arabia, the Netherlands, India, and by the Russians, British, and Chinese. Today, he dedicates his life to the health and well-being of the South African people at the Heart and Healthcare Centre in Durban North, using non-invasive, state-of-the-art full body feedback systems for the entire body, cardiac diagnostics, and non-invasive ECP natural bypass treatments for patients with heart problems as well as heart failure. Gives us pleasure once again, and for the first time in 2024, to say good morning, Dr. Rakesh Mohanlall. Thank you for joining us this morning.
Hi, good morning, Vishal, and good morning to the listeners. Happy 2024 to all of you.
And to you as well, Doc. Good to have you back on the program. Tell us, early detection and management, is this the new way? Enlighten us on how you can assist our listeners in this regard.
Well, that statement is so true, Nishal, as this is a paradigm shift in the way society thinks about healthcare today. They're trying to move away from medical care when they get sick to preventative healthcare. And this has boomed with the advent of the internet and accessibility to information. Because many smart people today research treatment modalities, they look at testimonials, they look at ratings of a medical professional or system before they choose what they want to do. So this has led to a revolution in the choice of healthcare modalities that they choose to use. Today, many in society realize that there is a need to keep their bodies and minds healthy and try and avoid getting sick, or to strengthen themselves to cope in the event that they unexpectedly fall sick. So today, patients search for the least invasive methods of screening, diagnostics, and treatment modalities before they are persuaded to allow their bodies to be subjected to invasive procedures, pain, risk, and unnecessary surgery and medication. Well, fortunately, there's good news for the listeners. Some of the most advanced screening, diagnostics, and treatment modalities in the world today are available at the Heart and Healthcare Centre in Durban North, which has benefited patients on a daily basis.
What is the name of the test that every listener can undergo to check the whole body from head to toe without pain at a reasonable price at the Heart and Healthcare Centre?
Good morning, ma'am. The test is known as the full body screening test. And full body suggests that it covers all organs and systems from head to toe. We can test every organ and identify which organ has loss in functionality as well as the cause of the problem. So we're able to recommend a correct treatment as well as medications that the patients require. So you get your entire body checked up in just one appointment. This is what we'll be discussing more today, and this is a must for every family, from 3-year-old children to their parents and to their grandparents.
Doc, there's something I'm sure all of the society will be interested in. Please tell us more about the full body biofeedback screening.
Okay, biofeedback is the future of screening and diagnostics. This technology uses your own body to identify illness in any part of the body. This in turn empowers the healthcare professional or practitioner to give the correct advice and structure your treatment accordingly. Some of the areas that you can test based on your question is blood supply to the brain, the tissue and the nerves of the brain. It tests the heart muscle, blood flow to the heart and the valves. It tests the lungs for infection and tests sinus issues, the lymphatic system throughout the body, the liver, the gallbladder, which are common problems today, and we see patients with fatty liver disease or gallstones. It tests each of your entire teeth and the bone of the entire skeleton. It can test the vertebrae of the spine and show us whether the back pains that you're experiencing is caused by degeneration of the bone due to osteoporosis or due to nerve damage caused by poor circulation and resulting in something called nerve ischemia. So this is a common problem with the back that people identify or experience back problems, and most of the professions identify it coming from degeneration of bone. But sometimes it's just a matter of blood supply to that area that's causing the nerve to become impacted or impaired. It tests blood circulation throughout the body and identify which parts of the body is getting insufficient blood flow and which may be causing weakness of certain organs or pain that you may be experiencing, for example, on the legs or constant headaches in some patients. It can identify vitamins, minerals, electrolytes, amino acids that you may be lacking. It provides an excellent detail of the gut and digestive system. Today, many patients experience severe problems with the gastrointestinal tract.
Mm-hmm.
So I think this test is a must for them to identify the cause of the reflux, heartburn, bloating, and constipation, to identify whether it's coming from bacterial infection or harmful bacteria, worms, parasites in the gut, or whether it's poor eating habits, or whether it's coming from the heart and manifesting as stomach pains. So this will be able to identify whether it's a problem with the stomach and what's the cause of the pain, and from there we'll be able to treat that. It will also pick up urinary tract infections in patients, respiratory infections, and fungal infection, even on their skin. It identifies the pH or the acidity of the body, so we can neutralize the pH should it be necessary. It identifies which vitamins, minerals, amino acids, as I say, may be low, and we can check the blood flow, for example, on the legs, and identify if that's the cause of the pain or pins and needles that patients experience, or numbness or hot or cold sensations under the feet. So it's a very comprehensive screening test.
Indeed. Now, once a patient's gone for the full body scan, what treatments can you provide briefly?
Well, after the test is done, the screening tool itself can actually perform a treatment called metatherapy, which can target certain areas of patients. And it's been very successful in treating patients with chronic headaches, stress, and pain-related problems. From the test results, we advise the patients on the correct treatment modalities, which may be needed, or medication. We also have a large range of very effective natural medication that treat patients like for body pains, heartburn, sleep problems, sinusitis, indigestion, constipation, stress, tiredness, even post-COVID and post-vaccine symptoms. We also have at the center other non-invasive modalities, and one of the most advanced tests in the world is called the three-dimensional vasculography. This is more for cardiovascular problems, so patients with very high pressure, strokes, or heart problems, or heart failure can be diagnosed with this machine. We can actually look for problems with the heart, the lungs, the kidneys, blood flow to each of the coronary arteries, which no other test in the world can do. There's no test that can measure blood flow to the coronary arteries. An angiogram is a good test, but it measures the plaque in the artery, not the blood flow in the artery. And we can then advise patients after doing this comprehensive test whether they should do angiogram, bypass surgery, or they would benefit from non-invasive modalities like what we have to offer. This is the most advanced comprehensive cardiac diagnostics in the world today. And there's no dye injected, so it does not damage the kidneys. We have a treatment called external counterpulsation, which is known as a natural heart bypass. And this treatment is non-invasively done on a patient where we use blood pressure cuffs on patients and trigger it by the ECG, and it increases blood flow to every part of the body. This brings back the elasticity of the blood vessels. It gets rid of tiredness, shortness of breath, chest pains. It can be done even before and after stent or bypass surgery, and it's very effective in heart failure patients. We can also do the treatment while the patient is literally having a heart attack because it increases blood flow to the coronary arteries immediately. It is absolute wonder in patients who had strokes within the first 3 months, as well as Parkinson's disease patients. Then we have echo as well, which measures the structure of the heart and gives us a good idea of what's happening in the heart as well.
Doc, please sum up which patients should be doing the full body scan, and how often would you recommend getting it done?
Well, a full body scan can be done by everybody and anybody, including children from 3 years and above. There's no risk, there's no side effects involved, and it's a non-invasive screening. It's reasonably priced. The patients who are experiencing issues that I've already mentioned, also patients who are not sleeping well at night, have indigestion, reflux, heartburn, arthritis, constipation, burning on the feet, knee pain, fatigue, shortness of breath, pressure problems, diabetes, and other issues should definitely get the full body test done. Remember that it's so important to get a comprehensive diagnostic done at an early stage, because it can be done in one affordable appointment and we can test the entire body. You would usually need to see many different specialists and do many different diagnostic tests to get treated with a trial and error method to identify and treat your issues. Whereas this machine is so accurate, it has a 90 to 95% sensitivity. So in one test, we'd be able to check everything.
Now, Doc, with everything that you've said and all of the descriptions that you've given and said to our listeners that this test can do so much, I'm sitting here thinking that this is going to break the bank. It's going to be the most expensive thing I've ever spent money on. You know, I mean, I'm getting messages from listeners saying, "Oh my word, it's pricey. It's going to be pricey." Is there a special? Is it expensive? Is it going to break the bank? What's the story? Let's talk money now.
Look, I mean, there's nothing much you can get for what we can offer you in this test. I mean, for something just for, hypothetically speaking, over 1,000 rand, there's not much you can do today. And with this test, you're looking at everything from head to toe. You know, we've had so fascinating results because of this test, Nisha, because of your show. So many patients have come here and benefited from it, and they literally shocked themselves that they got better because they had no hope before coming here. I mean, on Friday, it was such a great thing to see somebody coming here, and I treated him about 2 months ago. And this is an entrepreneur, a white gentleman, who came here, tried everything, tried all the doctors. He was so sick, and he had lost hope, you know. And I told him that, look, we can find the problem. We found it. We treated him only with meds, nothing serious, nothing expensive. And to see him come here yesterday, I mean, he was literally crying. It was so sad to see a young guy, an entrepreneur doing well, having a business, and his body just failed. And to see him come here yesterday to take one or two of the medications that he thought was working well for him from us, and absolutely normal. It was an amazing thing to see. Well, it wasn't yesterday, sorry, on Friday.
Friday, yeah.
It was such an amazing thing to see, and such a happy moment for us to see somebody from have lost everything, who felt he was at his wit's end, to see him back at work and, you know, getting back on the horse. It's a very nice feeling to see something like that, Nishant. So I don't think any amount of money can put a price on how that feels for us as a practitioner.
No, absolutely not.
As I said, for the amount of money that we charge for this test, it's financially not even viable for me to do it, but it's worth it for me to feel that or experience that joy to see somebody else get better.
Somebody else getting better.
For over 1,000 rand, there's not much you can do in society today.
So listeners asking if you at your center can do anything for a Parkinson's patient.
That's right. We've treated many patients with Parkinson's. I'll give you an example. We treated a patient from 600 kilometers, 400, what am I saying? About 500 kilometers away from us. I treated his son first, who could not see, and he started seeing after the treatment. He came from Eastern Cape, so then we treated his dad, who was 84 years old, who had Parkinson's. After 3 days, he could hold a cup of tea, a hot cup of tea in his hand. After 28 days, he played tennis for 2.5 hours at the age of 84.
What?
They bought him a Bentley as a gift, and he used to drive from there to this place after we treated him with ECP, and this was the Parkinson's disease.
Wait, now why didn't they buy you the Bentley?
I'm grateful they bought it for him. I think I need to stay humble, so Bentley may not be that good for me.
Absolutely. Listen, you get the Bentley, you send it to me, I'll move around.
No problem.
Last question for you today. Last question, and Nazmira is very, very, very curious about this one.
How do our listeners contact you or your practice in order to benefit from this limited special offer and benefit from your expertise and groundbreaking technology?
Okay, you want me to give them that first, and then you can tell them what special we have to offer the LNSR listeners?
Let's go for it.
Yeah, let's do that.
Okay. I'll give you the number first. We are on 031 563 0419. 031 563 0419. We're in Durban North, off Broadway, and we only take bookings, so we don't take patients who come off the street. So there's no walk-in patients, unfortunately. So I'd want Michelle or the lady to announce our special, so that LNSR listeners can really benefit from this.
Now, before we announce the special, the telephone number one more time, please.
Okay, 031
031
563
563
04
04
19.
19. And it's by appointment only, right?
Appointment only. And I'm sure you know that I always say this, as soon as this line drops, the phone will start ringing, so just bear with us, please.
There's only one
You can
phone
call
line,
us if
folks.
you don't get through.